Should we go?
Yes, I have recording now, and then maybe we can begin now.
Um, Emerson and Joanne, are you guys ready to go?
Yeah, we're good.
Yes, we are. Just a heads up, we're using the same link. So just in case you might be confused why.
Say it again, Joanne. You're using what?
We're using the same link, Emmer and I. So I just changed the name Emmer, but it's actually J on my screen. So just in case you might be confused about that.
Oh, okay. Okay. Thanks. All right. Well, why don't we go ahead and get started? Thanks everyone for joining us today. Today we are going to be hearing about co-creation, an innovative approach to addressing social health challenges. So I'd like to briefly first introduce our guest speakers. We have Joanne Cabaroy. She's a global health advocate dedicated to improving the health and well-being of children in underrepresented groups. She did her psychology degree in Manila at Centro Escolar University, and then also received a professional degree in global nutrition and health from the University College Copenhagen. She's volunteered at many refugee centers and interned at UNFPA. She's now pursuing an MPH at the University of Southern Denmark, and she is serving as the co-founder of the Living Lab Bayanihan, which is seeking to advocate for more equitable and democratic urban social and health innovations. And accompanying her today is Emerson Faba Bayar. He's an educationalist. He has a bachelor's degree in applied statistics from the Polytechnic University of the Philippines and a master's in education. He previously taught early childhood education courses in the Philippines, and he's been involved in a number of different studies for multinational companies. He was chosen as part of the Harvard HPAIR conference, and has been involved in designing and facilitating seminars in a whole wide range of facilities. So really delighted to have both of them leading this session today. So without further ado, over to you, Joanne and Emerson. Thanks.
Thank you, Joe. Hello, everyone. Welcome to our webinar tonight. Good morning, good afternoon, and good evening, whichever part of the world you are joining in right now. It's a rainy evening here in the Philippines. Thank you so much for joining us today. We're happy to have you join our webinar on co-creation, an innovative approach to addressing social health challenges. I'm Emerson. I'm the Chief Operating Officer of Living Lab Bayanihan. And joining me today is our ED, Ms. Joanne Cabaroy. Our mission is to help our partners address the gap and limitations of the current hierarchical and linear models in tackling social development and innovation challenges by harnessing the power of co-creation. Now, before we move forward, let us have a common understanding of what co-creation is all about. So the concept of co-creation emerged originally from business and marketing research and became a mainstream term around 2010 referring to consumers being able to contribute to product development. So the term co-creation is a dynamic concept that continues to evolve, and its definition varies depending on context. Now, in the context of social innovation, we will use this definition by Lino and Pumala, whereas co-creation is a multi-directional and a more democratic pathway to problem solving whereby the input from end users plays a central role from the beginning to the end of the process. So co-creation lies in the breaking down of hierarchies between the local government, business life, universities, citizens, and other relevant stakeholders. So what's our agenda for today? By the end of this session, we will be able to learn strategies for engaging the community and multiple stakeholders with diverse ideas and interests. And we will also be able to identify and reframe local challenges using the LLB framework. Now, before we deep dive into our topic, let's have a quick game first. All right, so I'll show you a riddle on screen, and all you have to do is to send your answer in the chat box. All right, so we'll be reading your responses. So are you ready? So you have 15 seconds to answer the riddle. The first person to get the correct answer wins. So here's our first riddle. So what can you put in a bucket to make it weigh less? What can you put in a bucket to make it weigh less? Please use the chat box. You have 15 seconds. All right. Nothing. Paper, feather. All right. Air, nothing. I think we got a correct answer. All right. So the correct answer is a hole. A hole. And we have Anjana Dakal. Congratulations, you won a bragging right to claim that you won our riddle game. All right. So congratulations, Anjana. Thank you for joining. We'll have our second riddle. So here, I am a house made of woods and nipa leaves. You can move me elsewhere, no truck or plane needed. But to move me with ease, what must be done first? All right, 15 seconds. I am a house made of woods and nipa leaves. You can move me elsewhere, no truck or plane needed. But to move me with ease, what must be done first? All right, dismantle, plan, install a wheel, air. All right, time is up. The answer is quite related to what Jacqueline said. And the answer is empty the house first, so we can move it with ease. Now, I have a question. Congratulations to, actually no one got the exact answer, but the closest one is Jacqueline, dismantle it first. That could be an option also, especially if your house is made from IKEA probably, where you can easily dismantle the parts of the house. But the answer is empty the house first. All right, so now I have a question. Has anyone of you seen a walking house? A walking house, not in television or not in movies, but in real life. Have you seen one? Yeah. Probably those from the Philippines. Yes, Amel said yes. All right, so yeah. Actually, here in the Philippines, especially in the provinces, it's typical to see a walking house. All right. Although it's less prevalent now than in the old times, since most houses here are already made of concrete or cement. And in this photo, this is actually a popular one of the popular depictions or symbols of bayanihan. So in this picture, as you can see, villagers of different age, gender come together to help physically relocate a bahay kubo or a nipa hut to a new location. Now, before the heavy lifting begins, the community works together to empty the house of its belongings. So for example, furniture is carefully removed and personal items are packed and transported separately. So you will also notice that there are several long bamboo poles that are lashed together to form a sturdy platform that fits underneath the house. So this one. Um, this platform acts as a base that evenly distributes the weight of the house, making it easier for the people to carry the house or to move the house to a different location. So working together, the men would lift the house and move it to the new location. The entire process would be a communal effort with everyone working in unison. Afterward, the family would express their gratitude by hosting a celebratory meal for everyone who helped. So Bayanihan is still very much alive in Philippine culture today, but its essence manifests in new forms. So for example, modern Bayanihan can be seen during natural disasters where people quickly mobilize relief operations using social media platforms. And Bayanihan is a deep-seated understanding that a united community is not just about weathering storms, but also about celebrating triumphs together. And this is the inspiration behind the Living Lab Bayanihan framework. For those of you who were not able to check our primer, here's a video explaining the LLB framework.
Is there a way to bridge the gap and limitations of the current hierarchical and linear models in tackling social development and innovation challenges? That's exactly what the Living Lab Bayanihan framework tries to achieve through the power of co-creation. It merges top-down and bottom-up approaches and leverages the strengths and expertise of diverse stakeholders. This means different parties at all levels provide input and effort towards the success of any activity, which factors in involvement and ownership, leading to more impactful and sustainable solutions. The Living Lab Bayanihan framework is a communal approach to co-creation and social innovations. It draws its core value from the Filipino spirit of communal unity and shared responsibility in achieving common goals without disregarding individual interests. LLB has 6 components. Need finding or problem orientation, which involves immersing with the users to unpack the complexities of the problem and explore a shared understanding of the issue at hand. Ideation or exploration, which requires the expertise to balance the power dynamics of stakeholders and ensure the spontaneous flow of new ideas and bring about invisible ones. Experimentation in real-life setting, where ideation, prototyping, and implementation of innovation takes place. Eco-feedback, which involves closely monitoring and evaluating the experiments. Data is collected on the impact, reach, and user experience of the solutions. Learning absorption focuses on analyzing the results of the experiments. Lessons learned are captured, and the co-created solutions are refined and improved upon iteratively. Replicate and upscale aims to take successful solutions from experiments and apply them on a larger scale, ensuring a wider reach and long-term sustainability. Unlike other user-centered designs, LLB has the flexibility to adjust to the needs of the users during testing in real time while the problems are still easy and cheap to fix. The key aspect of the iterative process has given this method an advantage to bypass the normative process of project phases. By continuously engaging with users and multi-stakeholders throughout the entire cycle, the LLB framework fosters a sense of shared ownership and empowers communities to drive positive change.
Yes, thank you for that, Emmer. Hello, everyone. I hope everyone is doing well. I'm Joanne again, and I'll be taking the session from here. As mentioned in the video, the LLB framework or Living Lab Bayanihan leverages the power of co-creation with users or community members to address social or health challenges. But let us start with definition first, or the objective of today's session, which is knowing and engaging with our users and stakeholders. Why do we prioritize understanding the people, or in our discussion, the users, in any social or health intervention? So allow me to define the users first. Individuals, groups, or communities, public or private, that are impacted by any innovation or intervention. There are actually many community-based research or even programs or intervention consider them already as knowledge generators and solution providers. Users also have the most intimate understanding of the challenges and nuances of their community. So what are the types of information you can gather to gain a better understanding of the community you are working with? As you can see, there are three, which are demographics, or what we call community profile, like gender, number of household members, occupation, language, or even education levels. These are actually essential in producing evidence-based information for planning and implementation of any projects or community development programs. Also, this information you can get from your local census or group registration, especially if you do have local government units. The second one is social cultural data. These are people's behaviors, perceptions, attitudes, or even values of the community, which could dictate the shape of social development and community adaptation to change. So I just wanted to share in our recent co-creation activity, we actually gathered social cultural data through youth sensing survey, or what we call youth dialogue or interview. These are actually conducted by our partners or youth leaders to gather information on the out-of-school youth's perception, interests, and attitudes on the topic of urban farming. So what we actually gathered helped us design the activities in the co-creation workshop. And the third one would be environment. So it can either be in two categories, which are physical, like space, the size of the place, or even, a country can be a major determinant of some health issues. So basically the condition of a house or a country that one is included in may have a differences when it comes to impact or developing risk. So the social factors, however, can include community safety. It can be violence, social connection, or social stability, which can serve as a buffer or catalyst to health disparities. Some data gathering, especially face-to-face, is actually a good opportunity, especially in LLB, to engage with them and build an open communication. All right, so next, co-creation actually emphasizes moving away from the traditional models where community members are seen as passive recipients of the solutions. As Manish stated, despite the power imbalance, the value of engaging communities as equitable partners in the design and delivery of community-based programs, which actually has gained popularity in recent years. Actually, people are seeing the potential of this approach already to an effective and sustainable implementation. I just wanted to highlight that treating users as co-creators balances existing assumptions and the reality of the situation. Often, the initial problem is not really the real concern of the community at hand. Likewise, when people feel like they're part of the whole process, they're more likely to get on board and be honest about the problem. So I just wanted to share a real life example during a typhoon crisis that I was actually a part of. Pregnant women during those times and their infants are actually at risk of health complications or even death due to destroyed hospitals and infrastructures. One of the results of engaging with the community, in this case, pregnant women and their families, is identifying the core problem, which is lack of transportation for them to go to a functional hospital to give birth, and not entirely because of lack of cash. Because of effective community engagement, a delivery mobile hospital is provided to cater to pregnant women that can reach far-flung areas and be used during a crisis. User or community engagement might look easy. However, based on our experience working with communities, some people are not easily comfortable with being a co-creator, especially if they have experienced being a passive participant before. It is important that when we approach them, we show genuine interest and create an atmosphere of openness where they feel comfortable in sharing their thoughts and ideas. In the case of our recent initiative with out-of-school youth, some practical examples of building trust and genuine connections are, the first one would be find an entry point. Normally, with out-of-school youth, we find common interests like sports, social media trends, And they are all actually incorporated during our icebreaker or workshop meeting. The second one could be encouraging first name basis across the process or during our session. This is to break the hierarchy element because in some cultures, we still use ma'am or sir and other authoritative titles. And number three would be consistent visits, even informal meetings with them according to their time is vital. Face familiarity is a prerequisite for gaining trust, especially if you're working with community. Last one would be open dialogue. By asking open-ended question is one of the practical ways to build empathy and respect. For example, one of the questions that we asked the out-of-school youth and youth leaders, what are the areas in your community that interest you, which you think we can all help to address the group? So this is a sample of an open-ended question that can be general, that can actually generate more inputs from them. Yes, as we continue to interact and engage with the users, we can already uncover the underlying issues behind the problem. This is a simple process of breaking down the overall challenge into smaller and specific sub-challenges. So just as what Emmer did in the icebreaker session, imagine relocating a full house without emptying its contents, which can be very heavy for those who will carry it. It's the same idea as tackling problems in a community. By breaking it down into pieces, it becomes less overwhelming and way more productive. This actually signifies the importance of understanding and potentially dismantling existing systems or practices that may be hindering progress in social innovation efforts. Now, just to give you a glimpse of an activity we did, kindly watch this video of our out-of-school youth and youth leaders for urban farming initiative, where all members of the ecosystem are all contributing according to their capacity.
Of course, nagtatanong. Ayun kasi of course, nakikilaw kami sa mga aktibidad ng musod. So,
yes, thank you so much for that, Emmer. I read some of the chat that there's no sound. I'm hoping that not everyone have the same case. Okay, all right, but okay, some of you have no sound and others have not. Okay, it's okay. There's no dialogue anyway. It's just like a background music, but hopefully you get the gist of it, what we did during the co-creation process. So as you actually notice, more than 60% of the time is dedicated to dialogue and interaction of all the members with the presentation, gains of their output to show the value of their active involvement and their role as agents of change. When we facilitate as LLB custodian, we actually facilitate cooperation activities, cooperation session, or even games. We actually treat ourselves as part of the ecosystem. As you can see, maybe in some of the clips, we actually joined, even though we are also a facilitator. So this is just to create that kind of harmony or facilitate balance whenever we do our workshop. Yes, again, allow me to share a case study in which investing in user engagement should have been utilized. Actually, this is a case where my colleague Emmer visited in an indigenous village near his hometown here in the Philippines. He actually saw an almost abandoned health center The center was actually built by a foundation along with local government units in the hope of providing health services to what we call GIDA communities or geographically indigenous disadvantaged areas. So before I proceed, I just want to take your time, maybe 15 seconds to reflect on why is it that the only health center in that particular community was not fully availed by its members. Everyone is welcome also to do it or make an entry in the chat box. Yeah, so the question is, why do we think that the only health center in that community was not fully availed by its members or by the tribes that it was built or intended for? I see lack of health officers, probably. Maybe a problem with access, yeah. No one is using that. Yes, yes, you are correct. I'm sorry, I cannot see the name, but there's a question, why is no one using the health facility? Yeah, that is the question. Location, no trust. Yeah, it's actually close. Thank you for everyone's input. Actually, Emmer had a chance to speak with one of the community members and learned that apart from the physical barriers to providing healthcare in the community, which is located in the mountains, doctors and village workers also had to deal with some cultural constraints. Traditionally, when the community members of the tribe are sick, they would actually stay at home and would not take any modern medication, fearing they would anger their gods and spirits. So that's actually the core problem. So part of engaging with the users is really understanding their beliefs and what systems are already working in there. Yeah, you are correct. As I can see it in the chat box. Yeah, maybe the personnel did not consult or engage the people, and that's the main reason why we actually put priority in engaging with the users. And also, in this case, introducing a system that is contradictory to their way of life without a plan for a new supportive structure can lead to instability and might just cause more problems than solutions. Now, I have a question that we can actually, or we would love to ponder on, even us working in LLB. So let me finish this part by inviting all of your inputs. So I'll give you approximately 20 to 30 seconds to answer or put your entry on the chat box. The question would be, how can now we leverage the community's beliefs, practices, and culture for them to embrace innovation or even change or even other intervention? So you have 20 seconds to, okay, I'm seeing now engage them. Perfect. Okay. The question is, how can we leverage the community's culture, beliefs, and practices? Raising awareness, yeah. Okay. Okay. Yeah, let's see, better communication, living with them through community, engaging them to find common. Yeah, what is community inclusion? There are a lot of good suggestions here. And actually, potential integration. Yeah, perfect. Integration. Yeah. Wow. Everyone, these are the things that we can actually use and maybe take note of personally. Yes, perfect. So some of the practical ways in LLB that we research and kind of try to adapt is actually, instead of fighting against established norms and values within the community, we should actually strive to align them, the goals of change, with those of their own goals. Number two would be aim to have a deep understanding of the people's culture and beliefs, which some of you have already suggested, like integration or maybe engaging with them. Even some of you have suggested leaving them at their house, talking to elders into, to take their wisdom into an account. Perfect. Yeah, actually, that's one of the main points. And actually we could actually find creative ways or connection points, that's what we call it, to incorporate cultural elements into the new direction. Investing in this part of the process, which is engaging with the users or the community, helps us avoid the pitfall of wasted resources or the gap between the community and the intervention. Thank you so much for everyone who actually participated. All of those are really great inputs. Yes, so let's go to the stakeholders. In the same way that we put importance on engaging with the users, we also recognize that solving social issues is complex and even multifaceted. Hence, stakeholder engagement is equally vital. As a definition, stakeholders are people who have a say, influence, interest, power on the project. Therefore, involving them is crucial in bringing diverse perspectives, skills, and even resources to the table. These collective insights help create a richer and more comprehensive understanding of the problem and contribute to co-creating solutions. In LLB, we really aim to balance the contribution of ideas and resources from all members depending on their capacity. What does it mean? It should mean that different level of contribution, but of equal sacrifice. So in LLB, how do we do this? How do we engage potential stakeholders? By merging the communal spirit of Bayanihan with the co-creation process of Living Labs, we actually create a more inclusive and effective approach to social innovation and stakeholder engagements. Some of these are leveraging community expertise. The LLB can be adapted to include a stage where all members identify their own specific skills, resources, or even talents. This allows for a more equitable distribution of tasks within the co-creation process, leveraging the expertise, and that's what we have mentioned earlier, even their own practices and beliefs. Number two would be building trust and ownership by actively involving community members in defining roles and responsibilities. It can actually foster trust and increases sustainability. And number three would be facilitating inclusive participation. I guess this is one of the highlight that we have whenever we engage or we have our co-creation session. We at LLB practice inclusive stewardship by incorporating techniques for fostering open communication and encouraging participation from traditionally underrepresented groups within the community. This actually ensures that solutions are truly co-created and reflect the diverse needs of the members of the community. So simple ways like community meetings, co-creating session, and celebrating milestones, this actually allows us to move beyond simply mobilizing a network of individuals to a model where community are actively involved, contributing their unique skills, perspectives throughout the entire innovation process. Now, let's apply what we have just learned. So I have here a case challenge. Addressing period poverty at a local public high school. This is actually inspired by one of our 3-day co-creation workshops with high school students in Metro Manila, located in the Philippines. So based on the case challenge, addressing period poverty at a local public high school, list down relevant stakeholders who you think can contribute to defining and addressing the problem. So you can see the link for a Mentimeter. So kindly click that link and put your entry on the chat box. So you just have to identify or list any of stakeholders that you can think should be involved or might or potentially be involved in this project. Yes, I'm seeing now entry, which is elders. Yes, perfect. Yes. So take note, any of, any people, community, groups that you can think of have a say, influence or even a power. Women, yeah. Makes sense. Girls, yes. I just wanted to emphasize that this is also in the setting is a high school or a school setting. Health workers, yeah. Okay. Can't see. Chinese Obu, you're saying that you can't see or hear anything. Yeah, I'm sorry for that, but I think others, you might want to refresh your Zoom. Okay, others actually mentioned head teachers, Ministry of Education, yes, school clinic personnel, perfect, yeah, definitely, since this is a school setting, good point. All right, let's have improving communication between mothers, yeah, mothers, mothers and daughters through advices by health workers, yes, point taken, thank you. Yes, maybe let's have community leaders, definitely, yeah. Let's say, yeah. All right, let's have 10 seconds more for other tab entry. Yeah, teacher, health educator or health education, teachers, Ministry of Health, thank you so much. All right. All right, thank you so much for all those who participated. Additional question though, this is just in the chat box. You can just put your entry point in the chat box. So aside from the stakeholders that you mentioned, which are teachers, parents, health workers, NGOs, parents, women leaders, even psychologists, can anyone in the chat box put particular resources, skills, or expertise that the chosen stakeholders can bring to the table? So let's say, for example, if you enter teachers, what is the particular expertise or resources that the teacher has that she can actually offer on this particular case? You can just enter it in your chat box if you like. So I'll give you 20 seconds for that to reflect and see if you can think of any resources. Yeah, rapport with the students, yeah. So maybe teachers already have an existing rapport, yeah. Anatomy and physiology knowledge, expertise and knowledge in the particular topic. Perfect, thank you, Anjana, yeah. Educational guidelines from Sarah, self-confidence building from Emil, administration course. Teacher knowledge from Carlos. Lynette, government to provide resources. Yes. Definitely, that's really a good point. Thank you so much, everyone, for all valuable inputs that you have provided. All right, let's move on to our next topic. Would be the second objective, which is to identify and reframe local challenges or the problem statement using the framework. So in LLB, co-creation does not only happen in ideation or finding the solution, but it actually starts with identifying the core problem from all of the members' perspectives. So as you can see, by working together, all members of the ecosystem, including the users and even stakeholders, can see a clear picture of the issue, including its interconnectedness to a whole web of other issues. This is what systems thinking teaches us, which is one of our principal theories. We actually see that social and health challenges are rarely isolated. In unpacking the social health problems in our community, there is a tendency for us to get overwhelmed. So I just wanted to actually take note. Our goal in LLB is not to address all identified issues, but to collectively agree on which problems to tackle sensibly based on available resources and collective interest. So one strategy that we actually apply in LLB is deconstructing big problems into smaller, more manageable pieces. In doing so, as custodians of the ecosystem, it's actually important to have an open mind during the process. All participants, including users, should have equal opportunities to contribute at all stages during this framework or the process of co-creation. All right, so I wanted to show you how our statement or problem statement evolves when a new member of the ecosystem is added. So we actually recently worked with a local high school, the same thing that we actually referred to in our previous activity, in which the school principal approached us to introduce mental health management education to the students. So the first stakeholder who approached us is the school administrator or principal, who initially raised the opportunity for menstrual health management education. By conversing with him, our initial focus is to increase awareness and knowledge. The first problem statement, as you can see, is how can the school educate students on menstrual health management? Now, the user in this case is menstruating students who were included in the dialogue. So as you can see on the left side, all possible stakeholders are listed. Note that this does not mean that all potential stakeholders must join or get involved. It actually depends on how the project progress and how the users adapt to the proposed solutions. So when menstruating students or users, when they got into the problem identification session, the majority raised concerns about pain management and lack of access to menstrual products at school. So the problem in increased access to menstrual products was actually added to raising awareness. So as you can see there, the problem statement evolved to how can the school educate students on MHM and increase access to menstrual products. All right, next one would be the school nurse. When the school nurse got invited to on the second day of our co-creation workshop, he raised concerns about the safety of the products, particularly pain relievers used by the students. Normally, peer recommendations of medication can pose a risk to their health if not properly monitored within the school or even at home. So the problem statement evolved: how can the school educate students on menstrual health and access to safe menstrual products? Then another stakeholder came whose focus is actually sustainability, which is an MHM advocate and waste management of used menstrual products. This again changed the main problem to how can menstrual health management education increase students' access to safe and sustainable menstrual products. You would notice that during the process of finding and committing stakeholders, the topic and problem statement evolved. This shows that identifying stakeholders and defining a problem are closely related. The issue determines who can be identified as a relevant stakeholder or vice versa. Every stakeholders involved in the project will have their interests and perspectives that need to be considered. Hence, the initial issue had to be adjusted. The diverse perspectives of stakeholders influence the specific definition of the problem. LLB and all the group in the ecosystem will have to address. But what is important in the end is to really frame the problem in a way that everyone agrees to it and inspires action to achieve the desired outcome. So just to give you the total change or the evolution of our problem statement, initial problem is how can the school educate students on menstrual health management? 2, a shared vision, which is empowering students through comprehensive menstrual health management education and access to safe and sustainable menstrual products. Now it's our time to get into action. As our participants, we would really love to invite you to join our Zoom whiteboard. So for those who are interested in joining, just click the link that I will be sending you here. Just a moment. Here you go. So you have now these whiteboard. I'll just go ahead and share the whiteboard. Okay. Yes, okay. Let me just go ahead and open the whiteboard. I hope everyone can see the whiteboard or the Zoom whiteboard. Can everyone send me a smiley emoticon or thumbs up if all of you can see the Zoom whiteboard? Yes, okay, all right, perfect. Thank you, and okay. Yes, perfect. Thank you. Okay, so now what we will be doing in the whiteboard. So this is also one of our cooperation activity, but this time in a digital way. So the problem statement is a private primary school canteen has had the same menu for years and needs an update to their canteen menu. So the problem is, how can the school canteen menu be updated or changed? We already have a predetermined various roles. As you can see, users, school administration, parents, canteen employees. So these are the types or roles of stakeholders that you can choose from. And feel free to take let me just demonstrate it to you. Take a sticky notes on the lower part. Let me just, okay. All eyes on me, as you can see. Okay, so these are the sticky notes. You can just get sticky notes and I'll just have to approve all, I guess. Yes, those are sharing, perfect. Okay. All right, so you just have to formulate problems based on the rules that you have taken and kindly write it under the designated stakeholder rules. So feel free to put your entry.
So for those who are having a problem accessing the whiteboard, I think you can just write your
Yeah.
input in the chat box. Just mention the stakeholder that you've chosen, and based on that stakeholder, what question can you formulate to
Yeah.
to help define the problem?
All right, I'm seeing some of the entries now. I'm approving some. Perfect. Thank you for everyone. Oh, sorry. Did I just select it? Wait, I'll just go ahead and do this first. I hope everyone is, yeah. Yeah. I think I got kicked out, but let me just go ahead and yes. Try to share my whiteboard again. Open the board. Seems that my board got kicked out. Let me just.
As a doctor, I chose to adapt meals according to age and suggesting healthy recipes.
I think I can share it. Just. Can anyone see my?
Yeah, it's shared.
You can see the whiteboard still,
Yeah.
right? Perfect. Thank you. Okay, while waiting for some of the answers, I can now start reading. Let's look at the users first, which are the students in this case. So some of the questions are, will the new menu have more variety than the last menu? That's a good question. Will the food taste good? It's actually a good, in a student's perspective, that is actually a common question. That's a good one. How about the school administrator? It shows here, will this impact the school's budget significantly? Yes, that's really a good one. Should the school needs to employ more members to serve for the new menu? Yes, that's something that the school administrator should actually consider. Okay. How about the parents, the primary, guardians of students? Will you consider my child's allergies? Actually, we haven't thought about this one, but this is actually a good point. Not all schools have the capacity to have this taken into consideration. The canteen employee, let's see, will it require more staff or resources to make the new menu? It's a good one. Is it going to take more time to prepare the food? As you can see here in canteen employees' perspective, you would already see that they are the main ones going to be impacted if this change would occur. So I believe this is really a valid concern. If I'm going to be if I am a canteen employee, this is something that I would definitely ask. Is it going to take more time? Would I have more resources?
Can you share the screen?
Oh, okay.
They said the screen is not.
Okay, let me just all eyes on me. Okay, are you not seeing the? I'm sorry. Does everyone see my whiteboard or no? Okay, let me just go ahead. Okay, thank you, Amber. I think I got kicked out of my whiteboard. But as you can see, each one of you, to those who participated, you actually provided a problem statement based on your chosen role as stakeholders. So problem statement differs, your concern differs based on your roles, based on your expertise, based on your even concerns. I just wanted to actually see the local supermarket and read this one. Okay, how can we provide a variety and affordable supply to the school? Would it compete with the local foods? Even though in this case, local supermarket might be, not so relevant stakeholders because it is outside of the school. But I'm very glad that someone actually thought about it, that they could also have an impact or influence, or maybe have an interest in changing the menu of a particular school. So thank you all for your valuable inputs, albeit its messiness. I'm actually grateful for the diversity of phrasing the problem statement that you actually provided. All right, so let's go ahead and continue. I'll just go ahead and stop presenting. All right. So let's go to our key points or summary. So LLB encourages us to deconstruct the problem into smaller, more manageable pieces, encouraging communities to take action. Early user involvement as co-creator fosters ownerships and sustainability. And also the iterative and inclusive approach to addressing issues actually promotes flexibility for other environment or social contexts. Who would like to use the same framework? We'd like to end with this quote. If we wait for the government, it will be too late. If we act as individuals, it will be too little. But if we act as communities, it might just be enough, by Rob Hopkins. And LLB is really looking forward to some more of a partnership and collaborative ideas like CHI. And we would like to thank everyone for allowing us to share to you some of our experiences. At the same time, our goal to really advocate for equitable and democratic approach to social health innovation through the power of communal spirit and co-creation and inspire community transformation. Thank you so much, everyone. These are also some of our references and contact numbers. So yes, I would like to end this by saying thank you to CHI staff and Hi, colleagues. Thank you so much. I'll turn it over to hi.
Thanks, that was great. Really well done. And for Emmer and Joanne, are you guys okay to take any questions? I see lots of thank yous in the chat box, but are there, if we have a couple more minutes, I have a question for you. I really like a lot of the co-creation sort of practical strategies and examples that you've outlined. Are there, in terms of co-creating with local communities, are there places where you feel like co-creation is maybe not the best tool? Like before you select co-creation compared to other strategies, how do you go about that decision? Like what are some things that you might want to take into consideration? Really nice talk though. Thanks.
So the question is, have you ever have you ever engaged in a community where we felt that co-creation is not
Okay.
the best approach? Was that the question?
Right,
Or-
that's
Yeah.
exactly the question. And I guess the related one is sort of like, how do you, when you're
Yeah.
choosing a participatory method, what are like, how do you think about like what might be a good thing to tackle with co-creation versus
Yeah.
using a different approach?
Yeah. Well, thank you so much for that, Joe. Definitely. In all honesty, introducing co-creation process in our context in community here in the Philippines, all of them are a bit harder at the beginning.
Yeah.
Because as I've mentioned in slides, most people or communities are not really used of being a co-creator agent. They are just passive participants. They come and go. If we get information from them, that's the end of it. And having the co-creation process where we don't have any solutions at hand to offer them, but rather we come to them and discuss possible solutions or possible problems even. It actually gives them that kind of feeling of uncomfortableness, as I mentioned earlier, because they're not that ready. However, as we continue doing it with some of the practical examples or strategies like just being present in the community, always, communicating with them, just checking them up together with their youth leaders in the case of out of school youth, they actually kind of loosen up. And that's where we inject the cooperation activities where we already discuss what are their thoughts, what do they think could be done to solve or even address simple problems. Yeah, but definitely it's always hard at the very beginning in our context here in the Philippines, based on our experience.
Yeah, I just want to add engaging with the users can be challenging, especially like when you're dealing with a bureaucratic system where you cannot just go to the directly to the users. You need to go through the barangay local leaders before you can actually directly interact. Of course, we can do that in our own capacity, but because we need to respect those authorities,
Yeah.
so we need to go through them and get them engaged in the project as well. And then, but once we break that barrier and we finally get the chance to engage with the users directly, that's when we actually get to co-create with them along with the authorities that are taking care of them in a way, like the local leaders. So yeah.
Thanks. Thanks so much. And there are a couple of questions in the chat box. If you guys have a minute, one, Carlos is asking about a book on the Living Lab.
Yeah, I actually see Carlos. Thank you, Carlos. Could you suggest a book on Living Lab Bayanihan? Actually, Emma and I are already collating some of the framework, but hopefully I will be able to publish one. But right now, just to be honest, Living Lab Bayanihan, we're actually collating knowledge based on each experiences and communities that we encounter and that we work with. This is really an evolution. Since we really advocate for iterative process, so we always evaluate ourselves, we always evaluate the framework, and we're really hoping to have this published and share it with you guys.
And I also just like to read out what Jana said.
Yeah.
I think sometimes in emergency situations, the co-creation process may not be feasible, but more effective interventions may depend on the strength of existing relationship. That's a very good point. Yeah, because what we notice with co-creation, the
Yeah.
process is slower
Yeah.
than the other human-centered approaches.
Yeah.
Yeah.
But actually, cooperation process is already like a good, shall we say, Jana? It's already like a good point wherein you can already establish fundamentals because community already have experienced a crisis, let's say typhoon in the Philippines. So they already know what to expect. They already know what are the resources that will be available, needed. So by having that cooperation process, the community would already be ready if that crisis happens. So yes, the cooperation process itself might not be wise to use when the crisis is already there, but you can already use it
Yeah.
by creating something beneficial when that happens. But that's really a good point. Okay, what else?
Um,
Yeah.
This is great. I just want to thank you guys again. You're welcome to stay on the link and answer questions. But in terms of the mid-year training workshop, we'll be having our next workshop a week from today, same time, same location. Thanks again, Emerson and Joanne. You guys did a great job and really nice presentation.
Thank you, Joe. Thank you,
Joe.
Sikai.
Thank you,
Thank you, everyone. You can just email us if you have specific questions regarding our framework or maybe collaborative ideas and opportunities. Just email us. We would love to help you out. Thank you.
Thank you, everyone.
Thank you. Have a good day.
Thank you. Bye.
Bye-bye.